We see a lot of people for genetic counseling, but there are really probably 6 questions that a person could ask themselves to figure out if they would be a candidate for genetic counseling. The first question, do you have a personal or family history of cancer, all of the same types of cancers on the same side of the family? That's question number 1. So the next question would be, has anyone in the family had cancer at an atypically young age? For breast cancer, this would be age 45 or younger. For colon cancer, it would be age 50 or younger. So if anyone in the family has had an early onset cancer, they are automatically a good candidate for genetic counseling and potentially testing. The third question, are there related cancers in the family? And by that we mean cancers that are known to be caused by the same genetic mutation. So for example, the same mutation that can cause breast cancer in some families can also cause ovarian and pancreatic cancer. So when asking about a history, it's really important to think of those as a cluster. Another cluster is colon, uterine, and ovarian cancer, as well as sebaceous adenomas and carcinomas. The next question would be, is this family of Jewish ancestry? If they are of Jewish ancestry, they're at increased risk for hereditary breast and ovarian cancer. The fifth question, is there any male breast cancer in this family? If there is, then automatically that family would be a good candidate for genetic counseling and testing. And then the last question, has any one person in this family had more than one primary cancer? So we don't mean someone who's had, for example, colon cancer that has metastasized to another site. We mean someone who's had more than one primary or new colon cancer, or a colon and a uterine cancer, or for example, a breast and an ovarian cancer. When we see people who develop several different types of cancers, it increases the odds that there's an underlying genetic susceptibility that put that person at increased risk to develop cancer. So this is a common question a lot of people ask, why would I want to know? And we even have people compare this to Pandora's box that, gosh, you'd never want to know. There are actually some very good reasons to know. If someone knows that they carry a mutation, it can really completely tailor their medical management. So if we know that someone who's a breast cancer survivor may be at increased risk for ovarian cancer someday, our goal is to reduce the risk that they'll ever develop that cancer. So if the person is over the age of 40 or done with childbearing, we may even recommend prophylactically or preventatively removing their ovaries and fallopian tubes before they can ever develop cancer. And while no one wants to have a preventative surgery, that surgery can often be done laparoscopically with several small incisions, and believe it or not, it's often done as an outpatient procedure. And so that's one reason a person might want to know. Another reason a person might want to know is it can really shape their surveillance. So instead of beginning colonoscopies at age 50 as we would in the general population, in some families we begin colonoscopies at age 25. In families with childhood onset colon cancer, believe it or not, we begin colonoscopies at age 10 or 15. And so it can really help shape the management. For some types of cancer, there are also medications that people can take to reduce their risk of ever getting cancer. So if we know someone carries a mutation, they can take a medication like that and reduce their chance of ever getting the cancer. Another very important reason that someone might want to have genetic testing is that it can help their whole family. So it can help their children, their siblings, sometimes their parents, aunts and uncles, cousins, even grandchildren. It can help us manage the entire family and reduce their risks of getting cancer. Most insurance companies do pay for genetic counseling and for genetic testing for families who really need the service. Not everyone can come in and get it. You really do need to have certain risk factors in the family. But if those risk factors are present, most insurance companies will pay for testing. Genetic discrimination was a main concern about genetic testing when the field first opened up about 10 to 15 years ago. Luckily, we've not seen a great deal of genetic discrimination. I would say the one area of exception is life insurance. And so if someone applies for life insurance, your family history counts, your genetic testing profile counts, some patients do decide to obtain life insurance before having genetic testing for exactly that reason. I would say that a concern that is a greater concern than genetic discrimination, which we hadn't anticipated, is how often the test results are misinterpreted. Several of these testing companies are out encouraging doctors' offices to order this testing. And of course, these people receive a commission on these sales. So they're really pushing hard for doctors and nurses, and sometimes even office managers, believe it or not, to order this testing. And they're telling them, we can help you order it, we can help you counsel your patients by phone. And so one thing that we found is that people are ordering this testing who actually are not trained or certainly certified in genetic counseling or genetics, and we've seen a high rate of result misinterpretation. And believe it or not, in some families, this has led to some people having prophylactic surgery that they actually didn't need. And in other families, it's led to people thinking they were at low risk when actually they were at high risk. So I would say the most important thing that someone could do if they want genetic testing is to make sure to get to a genetics professional who really understands how to interpret these test results. When someone comes back and we find out that they carry a mutation or they're at high risk for developing these cancers, we talk to them about actually 4 things. First of all, their options for surveillance. Second of all, their options for chemo prevention, which, as I mentioned, that's a healthy person who takes a medication to reduce their risk of ever getting cancer. So it's not like chemotherapy. Mm-hmm. The third thing we talk to them about is prophylactic or preventative surgery when appropriate. And then the last thing we talk about is the impact on all the other family members of this test result. And we help guide their family members in knowing who to test next. A lot of people think genetic testing, and they think this must be a really complicated ordeal. Believe it or not, it's a blood test. So we do it on a blood, usually 1 tube of blood, and it's really the ordering of the test and the interpretation of the test that's complicated. I think a good way to find out would either be to go to the National Society of Genetic Counseling website, which is nsgc.org, and they have something about Find a Genetic Counselor. You could also go to the National Cancer Institute, and they have a homepage that can help you find a cancer genetics specialist in your area.